Hi everyone, my name is Michelle Shooter and I'm one of the Assistant Chief Constables in Derbyshire Police, and I'm also a strategic member of the Drug, Alcohol and Substance Misuse Partnership which covers Derby City and the County of Derbyshire. Today I want to give you a clear picture of drug related crime in Derby and Derbyshire and highlight the work we're doing to reduce harm, increase treatment and protect vulnerable people in our communities. Over the past year, both drug trafficking and drug possession offences have risen in Derbyshire. Trafficking has increased from 738 offences to just over 1,000, which is a rise of 42%. Drug possession has also climbed by 46%, from 1,325 offences to almost 2,000. The current financial year continues that upward trend. I don't see this as a negative picture. These increases reflect better crime recording, stronger scrutiny and improved stop and search training, meaning we are identifying more offences and more accurately capturing the reality on our streets. In 2023 to 2024, Derbyshire saw the highest ever figures for county lines closures and organised crime group disruptions. Although those numbers dipped slightly in the following year, the first 6 months of 25-26 already show strong progress, with 19 county lines closed, 128 OCG disruptions. This puts us on track for another positive year of enforcement. So I guess the bit I want to cover here is, 1, the drugs market is evolving quickly and more dangerous substances, including nitazines, are contributing to overdoses and deaths. To respond to this risk, Derbyshire Police has equipped officers with naloxone. Over 1,000 officers have been trained with an exceptional 98% voluntary uptake. Naloxone has been now used 47 times and in every case has saved a life. So we're also focusing on support as well as enforcement. Operation Trapped is now firmly centred on partnership work and problem solving. Tackling root causes such as substance misuse and drug test on arrest plays a key role in identifying users whose drug use contributes to offending. So far, 953 tests have been completed. More than half have been positive, giving us crucial opportunities to refer people straight into treatment and support. In 2026, our priorities include further developing our naloxone work through a research partnership with the University of Derby. We'll continue to refine drug test on arrest, strengthen consequences for non-engagement and improve our drug testing turnaround times to support investigations. And we'll keep driving evidence-based partnership work to reduce drug-related deaths using data and intelligence to target the root causes of harm. Together, these approaches show a clear commitment, reducing harm, protecting the vulnerable and ensuring that enforcement, prevention and treatment all work hand in hand. Thanks very much for listening.
The National Drug Strategy, From Harm to Hope, makes it clear that prevention, so stopping drug use before it begins, or delaying the uptake of alcohol and drugs during childhood, will save lives, so it's really important for us to start with tackling those issues with our young people. In the most recent 2 years of data for Derby and Derbyshire, 215 under 18s were hospitalised because of alcohol, a rate that's well above the England and Midland averages. These numbers represent young lives at risk. We know that children's brains are still developing well past the age of 18, and both alcohol and drugs can harm that development. We also know that some children are more vulnerable to using drugs and alcohol, and the earlier people start to use, the more likely they are to have problems as they get older. What can start as an experimentation and fun with friends, or as a way of coping with challenging home lives or anxiety and depression, can quickly lead to problems such as missing school, more severe mental health issues, broken friendships and strained family relationships. Regular drug and alcohol use can sometimes spiral into antisocial and criminal behaviour. In the worst cases, some children find themselves vulnerable to being groomed and exploited, leading to trauma and being trapped in unimaginable and distressing circumstances. In 2025, the Drug and Alcohol Strategic Partnership Board brought local leaders together to tackle these challenges head on. We invited services offering advice, treatment and support specifically for young people in Derbyshire. We wanted to hear from young people too. Through the Here For You initiative, we heard from local students who are creating safe spaces where classmates could openly talk about mental health and stress, helping with problems before they led to substance use. They talked about peer-led work where young people provide support for each other and then access to specialist support services which are vital in reducing harms. We also heard heartbreaking stories. A teenager who used alcohol to numb the pain of bullying and another who experimented with drugs after family trauma. These stories make the data real and remind us why early intervention and care matters. We are committed to supporting those children and young people who need treatment and support services. Working across our partnership in schools and children's services, police and youth justice, we identify the young people who are really struggling with either their own alcohol and drug use or that of a family member and offer them support to provide hope and a better future. We also know that early intervention can make a real difference. Our next steps include increasing school-based programmes so that every young person learns facts about drugs and alcohol and the consequences, along with the skills for them to make the right decisions. We also use the data to target support in more disadvantaged communities where we know children are 1.5 to 2 times more likely to end up in hospital from alcohol and drug use. We are keen to continue listening to the voices of young people, recognising the value of their experiences and that they are the experts in their own lives. By focusing on preventing drug and alcohol use before it starts, we can reduce the number of young people needing specialist support and change futures for the better. Prevention today means hope for tomorrow.
My name is Dr. Fatima Altanay. I'm the Deputy Police Crime Commissioner for Derbyshire. The Listening to You survey continues to give the partnership a strong evidence-based understanding of residents' experiences across Derbyshire. In 2024 and 2025, 3,675 people took part. That represents 1 in every 290 residents. The respondent group was broadly reflective of the county by gender, age, geography, ethnicity, and sexual orientation. The results show that drug and alcohol remain persistent issues across our communities. 20% of respondents said they experienced street drinking or drunken behavior on a weekly basis. 22% told us they witnessed drug use or drug dealing weekly. The highest levels of street drinking were reported in Narrowash, and the highest levels of drug use and dealing were reported in Derby North, including the city centre. These findings will be refreshed after the survey closes on the 31st of March 2026, helping us to track changes over time and measure the impact of DASP activity. The public assurance meeting process has strengthened transparency and accountability around drug and alcohol-related work. From the 17th of February to the 3rd of March 2025, the Office of the Police and Crime Commissioner invited public questions on this thematic area and received 30 questions in total. Any case-specific details were removed and dealt with through casework. The remaining questions were passed directly to the force for formal response. These covered enforcement, reporting, and community engagement, and all responses were published on the Police and Crime Commissioner's website. The Year 2 public assurance meeting for this priority has opened on the 26th of January and will run until the 4th of February, giving residents another clear opportunity to scrutinise progress and raise their concerns. There have already been over 40 questions so far for the 2026 public questions on drug dealing and substance misuse. A dedicated Victims of Drug and Alcohol-Related Crime survey has been co-developed by the Office of the Police and Crime Commissioner, Derbyshire Victim Services and partners to capture genuine lived experience directly from victims. The survey launched in January 2026 and will be running till the end of February 2026, with full analysis to be shared with the DASP at the end of March 2026 to inform our priorities for 2026 and 2027. There have been over 400 responses so far. Lived experience is also shaping service delivery. As part of our partnership approach, we jointly commissioned drug and alcohol services, including the 1625 outreach service. This ensures young adults affected by substance misuse receive specialist and age-appropriate support. This joint commissioning approach strengthens early intervention, victim support, and pathways into treatment, all guided by what victims and communities tell us through engagement and survey insight.
When we look at drug and alcohol related harm across Derby and Derbyshire, the scale and complexity of the challenge is clear. Across the partnership area, it's estimated there are 4,800 people using heroin or crack cocaine, 2,988 in the county and 1,812 in the city. Encouragingly, 60% of drug users across city and county are in treatment, well above the England average of 46%, showing that local investment and engagement do make a difference. Alcohol, however, presents a much bigger treatment gap. Around 11,821 people are estimated to be alcohol dependent, 8,654 in the county and 3,167 in the city, yet only 25% of dependent drinkers in the county and 35% in the city are currently receiving treatment. This is, however, comparable to the rest of England, where treatment uptake averages are 24.5%. The consequences of drug and alcohol misuse are severe. In 2024, 95 people died from drug misuse across Derby and Derbyshire. Chesterfield has the highest rate of drug-related deaths in the county and the second highest rate in England per 100,000 people. Alcohol causes even greater harm, with an average of 208 local alcohol-specific deaths every year, a rate of 20 per 100,000, compared with an England average of 15 per 100,000. Over the last 4 years, partnership spending on treatment has increased by more than 30%, and we now invest over £10 million each year in treatment, prevention and recovery support. There are currently nearly 7,000 people in treatment across our area, 4,429 in the county and 2,548 in the city. We're also improving continuity of care. 57% of people leaving prison with a treatment need are now accessing drug and alcohol services within 3 weeks of release. With regard to quality of treatment, importantly, 41.6% of people in treatment are making substantial progress, either completing treatment or significantly reducing their substance use. This is comparable to the England average of 46%. This work is paying off. Hospital admissions for drug poisoning have fallen by 22%, from 425 admissions in 2022-23 to 330 in 24-25, bringing us below the England average. Looking ahead, there are emerging concerns. Powerful man-made opioids, known as nitazines, now circulating, are significantly stronger than heroin and far more dangerous. Similarly, veterinary tranquilizers are also being sold and equally pose a serious and growing risk. In response, we've strengthened joint plans with emergency services, expanded access to the overdose antidote naloxone, and developed a local drug information system that monitors drug threats daily. At the same time, alcohol harm is increasing. In 2023-24, there were 6,955 hospital admissions where alcohol was the main cause. Derby has the highest rate in the region and Derbyshire the third highest, both well above the England average. These figures underline why sustained investment in treatment, prevention and recovery is essential, because it saves lives and protects our communities.